Now the elephant in the room, this is complication number 3 or side effect number 3, which is hair loss. And hair loss has to be subdivided into temporary hair loss for a couple of weeks or months and permanent hair loss. So far in my hands, I didn't have any permanent hair loss. I'd like to keep it that way, but there's never a guarantee. Now temporary hair loss usually means that you have some thinning 1 or 2 inches above the scar. And this thinning is hair that has fallen out because of the move, the stress, etc. And then it comes back. And usually patients say, it feels like I have more hair than before surgery. And this is not just that it feels like, but it is, because what we have is we have this kind of internal clock for hair, where hair is growing over a couple of years, then it becomes dormant, it falls out, and then a new hair starts. And if you have all this hair shedding, which is called telogen effluvium, shock hair loss, and then all this hair starts growing at the same time, it's a little bit like rush hour in Tokyo. There is no space in the subway anymore because everybody wants to rush into the subway. So yes, you can feel that you suddenly have more hair because you reset the clocks of all these hairs. Complication number 4 is the optical as well as emotional illusion that your hairline is still too high. This happens in about 3 to 5% of my patients, that in the first couple of weeks they have these doubts. I think it's still too big, I think my forehead isn't lowered enough, or it looks that it's too high because the scar makes it so apparent that everything is highlighted. We created a separate video on this. And lastly, we have the emotional roller coaster. It's an aspect that a lot of plastic surgeons never talk about. I think it's very, very important because facial plastic surgery usually means you go 3 steps back before you look better. You have a scar that is red, you don't feel your head, you might lose some hair. That means that some patients might feel victorious in one moment, yay, I finally lowered my hairline, and then you look in the mirror and say, oh my God, what have I done? All to the extreme of feeling depressed. These are the 5 aspects that are typical for halo surgery, and I hope this was helpful. And if you have any other questions, feel free to DM us, email us, or give us a call.